know that according to the United Nations, age 60 and above is tagged elderly, and according to the World Health Organization, from 65 years upward is tagged elderly. This is to tell you that we have a lot of people around us that are elderly, and we do not even know. I'll be talking to us about what are the things we should look out for in our elderly patients, how we can take good care of them, and how we can ensure that they are really aging with dignity. Welcome back again to the Gist with Dami. In today's video, I'll be talking to us about the International Day of Elderly People. Basically, we celebrate them on the 1st of October of every year.
So we are live at the Geriatrics Day 2024.
For this year was aging with dignity. Do you know that according to the United Nations, age 60 and above is tagged elderly, and according to the World Health Organization, WHO, they tag it from 65 years. However, in different countries, they have different range. In a developing country like Nigeria, it starts from 60 years, and this is because the standard of living is poor. So for people to get to that age, we already tag them as elderly. Now, one of the things I noticed in this year's International Day of Elderly is that most of the elderly people I saw, they were not looking very good. I know that there's hunger in the land, there's depression in the land and whatnot, but I feel that our elderly are being neglected. Just to tell us again that our elderly are valuable, and one of the ways they can age with dignity is by we ourselves showing them the love, the support, and the respect that they need. Elderly are being neglected, and these are the set of people that we should take care of. The way we nurture and take care of children and our babies, so also we should take care of these our elderly ones, because at this age, most of them, they go through a lot of challenges. Also, in this video, I'll be talking to us about some of the common challenges that the elderly people face on day to day that you might not even notice if care is not taken. One of the major things they complain about when they come to the hospital is that, doctor, I have poor sleep. I can't sleep well. We tag that insomnia. A lot of elderly people go through this because, most of them, they don't really have much activities that they are doing during the day, and during the night, they just find themselves rolling on the bed over and over again without having a headway. And sometimes it is due to some underlying health conditions. Also, another thing I notice is that most of these elderly people, they usually come out depressed. They don't have anyone to talk to. They are usually neglected by their families. Some of them don't even have neighbors. So this can easily lead to depression. This is a time that we as the children, the grandchildren, it is our responsibility to ensure that our elderly people are well taken care of. We visit them often. We share beautiful moment with them, because these are the things that prevent them from falling into depression. Another thing that I notice is that most of them, they have poor eyesight, right? Because aging, right? So this is quite normal for them to have this kind of manifestation, hearing impairment or some eye defect, and most of them complain about their eye thoroughly. So now this is the time that we as the environment, the children and every other person around, we should support them. Because most times you feel like, oh, maybe you just see an elderly on the road and you feel that this elderly is even ignoring you, not knowing that they have some eye impairment. So these are some of those things that we should look out for. Another thing is that they are prone to falls. Yes, they are prone to falls. One, because of their eyesight, as I said, and sometimes their living environment is not conducive for them. Some of them, they live in a slippery house or the poor lighting in the house. So this could predispose them to fall. And you know that when an elderly falls, of course, it could lead to broken bones. It could lead to more serious conditions that could require hospitalization. Another thing I notice about the elderly is that they are prone to infections. So be it respiratory tract infection, urinary tract infection, most of them are prone to infection. So basically, the purpose of me highlighting this is so that when you have an elderly, it is your responsibility to ensure that you take them to their health providers as frequent as possible. So they should, one, be registered with a health provider. That's one. And two, you should make yourself available for the days of their visitation, because they might not be able to answer all the questions. Some of them, they suffer from some subtle memory loss or some memory impediment, so they might need someone around them who is going to tell us exactly what is going on. This video again is to help as many people as possible to know that elderlies are a blessing in our community, in our society, and in as much as we feel that probably at this age there is little to none that they can contribute, these people are highly valuable. If you want to see more of this kind of videos, or if you want me to highlight some of those things that I've mentioned in this video, drop it in the comment section, and see you in my next